People come to Greenwich Hospital for their maternity care because it is simply one of the best places to deliver a baby. It's state-of-the-art when it comes to labor and delivery, postpartum care, and even care before you have your baby.
The thing that sets Greenwich Hospital apart from other hospitals is we really and truly put patient care first.
We can provide comprehensive care to even the very highest risk patient. We have wonderful doctors. I've worked in some of the finest hospitals in the country, and this hospital is on par with many of those.
What women can expect in labor and delivery at Greenwich Hospital is the highest standards of care and safety. Your safety and your satisfaction are paramount. We want to make sure you have a healthy and happy birthing experience. We have an exceptional group of nurses who are amongst the most caring I've ever seen.
As a labor and delivery nurse, we are by both mom and dad's side throughout the whole labor experience. We take you through every step of the way.
My role as mother-baby nurse here at Greenwich Hospital is to help educate the parents and the moms on how to take care of themselves, how to take care of their babies. It's also to help the parents ease into their new role as parents with their newborn baby.
We have many ways that we assist moms with breastfeeding and feeding their babies. We have prenatal breastfeeding classes. While they're at the hospital, there's a lactation consultant helping mothers at the bedside with feedings and answering any questions they may have.
We are very aggressive in helping manage pain. We believe it is one of our major obligations to ensure that you have a comfortable childbirth.
We have a top-of-the-line security system that is activated continuously. Patient safety is of the utmost importance here at Greenwich Hospital. Before discharge, parents get to enjoy a really wonderful celebratory dinner that they bring up just as a send-off to say congratulations. We want to make sure that it's an unforgettable, positive experience.
We decided to come to Greenwich Hospital because of the nurses mostly. We came to the pregnancy fair and took the tour, met several of the nurses, and they were super friendly. They said that you could keep your baby in the nursery overnight if you wanted to, or they could bring him to you if you wanted. There were a lot of options, it seems, and I felt like I would be kind of catered to.
My nursing care was absolutely extraordinary. The labor and delivery nurses were wonderful, and I was in labor and delivery for over 30 hours, so I would know. And they couldn't have been more caring and understanding and supportive.
It was very soothing. It was, a spa-like, actually, is kind of how I've described Greenwich to other people. But it ultimately came down to the nurses and the care that I knew that I would get here.
The perinatology services at Greenwich really are very comprehensive and truly state-of-the-art. A perinatologist, or otherwise known as a maternal fetal medicine specialist, really is involved with taking care of the high-risk patient. We do a lot of ultrasound. In terms of prenatal diagnosis, we follow patients. We might make a diagnosis of an issue, and then we determine what would be the best course for that pregnancy, what would be the optimal timing of the delivery. We have a genetics counselor who helps with prenatal diagnosis and counsels patients about the various tests that are available to them. We have a diabetes nurse educator.
Gestational diabetes is a type of diabetes that occurs in about 18% of all pregnancies. The good news about gestational diabetes is that when it's managed by diet and monitoring blood glucose levels, it has no ill effects on the mother or the baby. We have all the tools in the toolbox to take care of this, so you will be ensured to have a healthy baby.
In addition, we have some very skilled sonographers who do the ultrasounds on our patients. And ultrasound allows us to show normal fetal anatomy. For the most part, it's uneventful. It's also an exciting time for the families. We can get some amazing pictures of the baby. We try to give every patient who comes in a 3D ultrasound picture to take home. This is a very nurturing environment. Sometimes you just need to be able to hold hands with somebody who can walk you through the process.
We're fortunate in that in our institution we have our neonatal intensive care unit basically within the confines of labor and delivery. This allows excellent communication between the neonatologists and the people involved in your care. Your baby is right next door. If there's an emergency, the neonatologists and the nurse practitioners can assist the obstetricians immediately. There's no delays involved. you'll get an exceptional level of care for your newborn.
We work very closely with labor and delivery, the obstetricians and the perinatologists, and we're always prepared for any baby that needs special attention, needs to be admitted in the neonatal intensive care unit.
The majority of our patients are between 27 and 37 weeks gestation. However, we take care of babies that are over 37 weeks gestation that require any sort of intensive care or additional care.
Babies that need special attention, they have respiratory problems or they have infection problems, we can within seconds be at the baby's bedside. We have state-of-the-art ventilators and incubators.
We treat our NICU babies as if they were our own. The whole maternity unit is family-centered, so we don't only treat the patient, we treat the whole family.
We have a special parents' room. There is a comfortable couch, they can sleep, they can go there and use the internet. It gives them some privacy and some time to relax and rest.
Even though most parents and families are nervous about the fact that their babies have been admitted to the neonatal intensive care unit, we find that by the time they leave here, which may even be a day or two later, they're quite happy because they find that they've gotten individualized and specialized care.
Post-delivery, my nursing care was absolutely phenomenal as well. They were extraordinarily attentive. Whatever I needed, they were there very, very quickly.
We live in New York, and so everyone has been asking, why would we come up here to Connecticut? And I wouldn't go anywhere else. There's a hospital that's 5 minutes from us. This is 30 minutes from us, and this is so worth the drive.
This is an extraordinarily supportive and caring environment.
The most exciting part of the job, as it has always been for me, is handing somebody a healthy newborn baby and just watching the joy on the face of the parents and grandparents as that new person comes into their lives.
I think the greatest feeling is being there at that moment with both parents when their baby is born.
Seeing the moms for the first time, the joy that they have when they hold their little ones, it's just such a privilege to be a part of that, to share that with all of our patients.